Cariprazine is an atypical antipsychotic used to treat schizophrenia and acute manic or mixed episodes due to bipolar disorder. In this video, let's found. What is cariprazine? What class of drug is cariprazine? What is cariprazine used to treat? Who cannot use cariprazine? What are the side effects of taking cariprazine? How does cariprazine make you feel? How to use cariprazine? What is cariprazine? What class of drug is cariprazine? Cariprazine, sold under the brand names Vraylar and Vraylar among others, is an atypical antipsychotic originated by Gideon Richter, which is used in the treatment of schizophrenia, bipolar mania, bipolar depression, and major depressive disorder. Cariprazine was approved for medical use in the United States in September 2015. It was approved as a generic medication in 2022, but is covered by patents until 2029. What is cariprazine used to treat? Cariprazine is indicated for the treatment of schizophrenia in adults to manage both positive and negative symptoms. It is also indicated to monotherapy for acute management of manic or mixed episodes associated with bipolar disorder, bipolar mania, in adults, and acute management of depressive episodes associated with bipolar disorder, bipolar depression, in adults. Who cannot use cariprazine? Vraylar is contraindicated in patients with history of a hypersensitivity reaction to cariprazine. Reactions have ranged from rash, pruritus, urticaria, and events suggestive of angioedema, example, swollen tongue, lip swelling, face edema, pharyngeal edema, and swelling face. What are the side effects of taking cariprazine? Side effects may first appear several weeks after starting cariprazine. The most prevalent side effects for cariprazine include akathisia and insomnia. Cariprazine does not appear to impact prolactin levels, and unlike many other antipsychotics, does not increase the QT interval on the electrocardiogram (ECG). In short-term clinical trials, extrapyramidal effects, sedation, akathisia, nausea, dizziness, vomiting, anxiety, and constipation were observed. One review characterized the frequency of these events as not greatly different from seen in patient treated with placebo, but a second called the incidence of movement-related disorders rather high. Pharmacodynamics. Cariprazine is an antipsychotic agent. In clinical trials, it reduced positive and negative symptoms in patients with schizophrenia and acute mania in patients with bipolar disorder. In animal models, cariprazine showed therapeutic benefits against cognitive deficits, mania, and catalepsy. In a meta-analysis study, cariprazine was shown to improve anxiety and depressed mood in patients with psychosis. As cariprazine is a partial agonist at dopamine D2 and D3 receptors, it produces an apparent lower blockade level than other antipsychotic agents that block dopamine receptors. This receptor binding profile is advantageous as dopamine receptor blockade is associated with extrapyramidal symptoms as side effects. Partial agonism would allow the dopamine receptor to be stimulated even at maximal receptor occupancy by the drug. Antagonism at 5-HT1A6 and 5-HT2A receptors by cariprazine can increase dopaminergic neurotransmission in the nigrostriatal pathway, thereby further reducing the risk of extrapyramidal symptoms. However, cariprazine is still associated with a risk of akathisia, extrapyramidal restlessness, and tremor. How does cariprazine work? While recent research points to the involvement of multiple neurotransmitters in the development and maintenance of schizophrenia and bipolar disorders, the dopamine hypothesis has been and continues to be a key theory in understanding the pathophysiology of these psychiatric disorders. Dopamine is a neurotransmitter that plays several important roles in cells, and most importantly, it is a crucial neurotransmitter involved in reward processing and motivation. The nigrostriatal, mesolimbic, and mesocortical systems consist of dopaminergic projections. The dopamine hypothesis states that dopamine aberrations are observed in schizophrenia and bipolar disorders. For example, hyperactive dopamine D2 receptor activity has been associated with positive symptoms of schizophrenia, such as hallucinations and delusions. On the other hand, alterations in dopamine D3 receptors may be involved in negative symptoms of schizophrenia. It was stated that hyperdopaminergia, caused by elevations in D2/3 receptor availability and a hyperactive reward processing network, underlies the development of mania in bipolar disorder. Half-life. Cariprazine and its active metabolites have long half-lives. Terminal half-lives of cariprazine, DCAR, and DDCAR ranged from 31.6 to 68.4, 29.7 to 37.5, and 314 to 406 hours, respectively. The effective half-life, calculated from time to steady state, or the functional half-life of total active moieties, was approximately 1 week. How to use cariprazine? Schizophrenia. Treatment of schizophrenia in adults. 1.5 mg POQ/day initially, may increase to 3 mg per day on day 2. Depending upon clinical response and tolerability, further dose adjustments can be made in 1.5 to 3 mg increments. Dosing range is 1.5 to 6 mg POQ/day. Dosages greater than 6 mg per day do not confer increased effectiveness sufficient to outweigh dose-related adverse reactions. Bipolar I disorder. Manic or mixed episodes. Indicated for acute treatment of manic or mixed episodes associated with bipolar I disorder. Day 1, 1.5 mg PO. Day 2, increased to 3 mg PO. Day 3 and thereafter, depending on clinical response and tolerability. Further dose adjustments can be made in 1.5 to 3 mg increments. Dosing range is 3 to 6 mg POQ/day, not to exceed 6 mg per day. Depressive episodes. Indicated for treatment of depressive episodes associated with bipolar I disorder. 1.5 mg POQ/day initially. Depending upon clinical response and tolerability, dosage can be increased to 3 mg q/day on day 15, not to exceed 3 mg q/day. Major depression disorder. Indicated as adjunctive therapy to antidepressants for treatment of major depressive disorder, MDD. 1.5 mg POQ/day initially. Depending upon clinical response and tolerability, dosage can be increased to 3 mg q/day on day 15, not to exceed 3 mg q/day. Clinical trials, dosage titration at intervals less than 14 days resulted in a higher incidence of adverse reactions. Are there specific concerns about cariprazine and pregnancy? Use in pregnancy, pregnancy category D. Non-teratogenic class effect, neonates exposed to antipsychotics, including cariprazine, during the third trimester of pregnancy are at risk of adverse reactions including extrapyramidal and/or withdrawal symptoms that may vary in severity and duration following delivery. That's all the information about cariprazine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.